So here's a little bit more data on suicide to sort of lead you into the next part of the talk. These were data on omega-3 fatty acids from patients who were in the hospital here with bipolar disorder or schizophrenia or major problems. They were admitted for suicide. We got their blood and looked at it. Those that had high levels of omega-3 fatty acids, 1 out of 16 had a repeat suicide attempt after 800 days. We didn't give them omega-3s. We just looked at what their blood levels were in the hospital. If they had low omega-3s, 50% of them had a repeat suicide attempt after 800 days. Now, we were very lucky with this population because the investigators, John Mann, they also got brain images of these subjects here and looked at the activities of their brains to predict what parts of the brains were having problems that predicted who had a suicide attempt and who did not have a suicide attempt. So, these are pictures of the brain, and overlaid the gray and the white are differences between the suicide attempters here in black and the non-attempters. So they had higher activity, higher brain activity. It's a measure of glucose uptake, especially right here, near the prefrontal cortex, right there, in the limbic forebrain. It was hyperactive. It was like what we see in PTSD. It's sort of like the foot's on the emotional gas. You're nervous and impulsive and distressful. And those are the guys who had suicide attempts in the future. Those that had hyperactivity of that area of the brain that we know very well is associated with distress. It was too active. Now look at this. Lower levels of omega-3, of DHA in the blood, lower levels was pretty tightly associated with excessive activity levels of that brain. Look at that, from 0.7 to 7, tenfold difference was associated with hyperactivity of exactly that part of the brain. The other finding was that in suicide attempters, they not only had the foot on the gas, but they had no foot on the brake. It's kind of like the Toyota syndrome. Pretty soon you go slamming into something. The cortex was not very active, and low levels of DHA in the blood predicted low levels of that cortex. So you can see, so we're just on the verge of starting to understand how some of these mechanisms might work. We do a lot more work to know exactly what's going on here. But I thought I'd bring you into this different part of the talk, and I'm happy I did this because Ken Ford said you have anthropologists here at his institute and broad thinkers. So I had to learn about these brain regions and what they were primarily used for in normative states of the brain. And what they're primarily used for is to encode meaning. Now, how do you encode meaning in a brain? Well, it's kind of like Pavlov's dog. You see the dog, you give the dog the picture of a red light. If you just give a red light, it's meaningless. If you get the dog hungry, give the red light and pair it to food, pretty soon the dog knows, red light, food, red light, food, red light, food. So you've strengthened the neuronal connections between the emotional areas of hunger and the visual perception of the red light. So that's the sort of simplest way to describe it. But many neuroscientists think that nothing you see in the environment has any meaning unless it's attached to an emotion, unless it's connected to an emotion. Okay? Now, what if all of your emotions are distressful, like you're depressed? Well, then everything in the world looks lousy. And what if you eat a lot of Florida fish and come to lectures? And your brain is tuned to lightness, and everything looks happier, like me. You know, I like a positive view of the world, right? So that's how we encode memory, and so I got thinking broadly, and I said, okay, here's a woman and her brain, and she's pregnant, and her husband cooks up a nice fish. And she says, it's delicious. She says, no, I'm not going to eat that. It's nasty. It's full of mercury. Right? No. She says, no, the U.S. government's, so how do you know it's nasty? You see it, the visual cortex.